Good morning, everybody, and welcome to the House of Jin Shin 2021, our first one. And I wanted to start up with a bang, and we'll talk about, I call it our favorite subjects, because so many people have low back, hip, and knee projects. And I have this very, very effective flow that I would like to share with you for self-help. You can also practice it on a loved one. And many years ago I had a snowboarding accident, and I've had a back project come up sometimes. So when I was in Colorado, Maria gave me this flow, and it was just so enormously effective that I wanted to share it with you. So let's get right into it. So use the side that is the project for you, be it the right or the left, and place your hand on the lower back and hook your fingers into where there is tightness, if any, and I'm sure most of you can find some. And then with the other hand, you're going to hold your toes. So we're going to work through the toes, from the little toe all the way to the big toe. And so that's the first step, really. And you're going to wait till the tightness resolves. And Lola, can you just check that people can see my toes and how I get in there? Because it's really important that if you have low back projects or SI joint, anything, any area related to between the 2 and I would say low 25, really, this is gonna resolve that. So if you have an SI project, a low back project, a hip project, a knee project, you're going to find tightness in the toes. And so really feel it, like put your thumb in there and see where the tightness is, and then wait till it resolves. So we're not going to quite wait all the way today, but when you practice this on your own, then really wait till the pain goes away, until it opens up, which should be a couple of minutes. So you can check the base and the front and the back of the toe. So you can place your finger on the palm side, and then the thumb on the top side, and then go on the inside. And we all know that the little toe helps the kidney and bladder flow as well. So again, you're helping your body on many different levels. And then let's move to the next toe. And then observe which toe also feels fullest, tightest for you. And you can stay with that one a little bit longer. The ring toe helps the gallbladder energy as well as the mediator energy. So again, learning about your own body and feeling where your need is. If you have more of a gallbladder flow need, I can imagine that your hand goes out a little more lateral to the side. So these are all things to study and continue to take a look at yourself. If it's kidney energy, you're closer to the spine. If it's bladder, you're a little bit more out. So again, it's really the art of getting to know and help yourself. And then let's move to the next toe. The middle toe, very, very important also. It is where the essence of breath and the essence of food come together, mix, and then cycle again through the body. So this middle toe tells you something about that. Also the stomach flow moves into this toe. So for me so far, I think the little toe is tightest, but it's already opened up quite a bit. And then we'll go to the second toe. We call it the eye toe, and so I'm holding it mostly on the bottom part, but for you it may be more in the middle or at the tip. And again, that tells you, of course, about the chest line, the waistline, and the hip line, and all the attributes associated with that. And then holding the big toe. Take a nice deep breath here, and by now your SEL2 has opened nicely. And you're always waiting for the pulsation to come up in both areas, and you just wait till it harmonizes. And that's when you move to the next step. And then we're going to make a ring with our ring finger on the back like this. This helps the lungs, so that helps everything, helps to open up the back. And you see how we're now bringing in this mediator aspect by moving to the other side of the body, where I'm holding the left side and I'm holding the right fingers. And then the little finger. So as you're becoming more aware, you can see on how many different levels we're helping with one simple flow. Very good. So you can leave it there, or you can we're moving along. I'm going to share with you 3 little flows, and the 3 in combination are very powerful to release any of these projects of hip, SI joint, low back and knee project. So we're now going to move our hands from the 2 to the 25, and we're going to go on a low 25. Now in Japan, Haruki Kato, he always used the low 25. Mary Burmeister, she used more right on the sits bone, and Kato used more on a lower. So let's go lower for this purpose. And we will again work through the toes, move through the little toe all the way to the big toe. If you have this kind of project, you will find a tight spot, particularly if you work on someone else, or if you ask someone else to work on you, then it's easier to find. It's a little bit harder to find on yourself. But you will find a tight spot. Now you can straighten your leg out a little bit more, but obviously we're holding these toes, so we have to bend our leg. So by this time your toes probably will have opened up a little bit from the previous cycle, but if not, then just stay toe by toe till they open up, till it's not painful anymore. So moving from the little toe all the way to the big toe. And you can look back at this video. We will also put it on YouTube, on our YouTube channel, and so you can always find it there. It will be under back, hip and knee pain. And when you practice often, you feel how quickly it all opens up. So I'm now at the big toe. I worked through all the toes, and I'm now gonna let me see, I'm gonna go to the other little toe and ring toe. So to the opposite side of the sits bone that you're on. And see if there's any tightness there. So this is so interesting, removing the energy over to the other side. So for me, the left toes felt tighter than these. When they're tight, you stay with them till it resolves. If they are open, you can move along a little bit faster. So we're just going to hold the little toe, the ring toe, and the middle toe. Take a nice deep breath. So we're holding them one at a time, not all 3 at once. And then again, we're going to make a ring with the little finger and then the ring finger. And then I'm going to present to you a third little flow, and again, I'm telling you that these 3 flows together resolved a big project I had. So, really work with this. And it was actually one time this flow was practiced on me by someone else, and it just really resolved it. So it's fabulous. So use it. Sometimes people ask me, do you have to believe in Jin Shin? And I say, you really don't, because it just works. If you practice, it's going to work. All right, so then let's move our hand to the 15. 15 again, this is a Kato flow, so we're going to go a little bit lower. Mary uses it right here in the groin area, and then Kato goes lower. And for me, at that point when I had this project, there was a really tight spot here on this 15. And of course we know that 15 helps the back. It helps to release the back. So it also helps the SI joint. If you have a project in the SI joint, then there will be a tight spot on the upper thigh. I'm going to have to bend my knee here to hold my toes, and you probably do too. If you have somebody that can give you this flow, then please go ahead. You would switch your hands around if you work on someone else, so it would be like this, opposite. Okay, but for the self-help, you can always make it easier and simplify and make it comfortable, and I find that this works really well for me. So we're going to hold the big toe on the left side, so we have the lateral 15 and the big toe. And here again we're helping SEL 7, which means stillness. It's where the exhale becomes the inhale, and we're also helping the liver energy and the liver flow and the spleen flow. They both begin on the big toenail. So again, helping on so many different levels. And then we're going to move the hand to the 13, but it's actually a low 13. So if you're a woman, you can go right on the breast area or even right below the breast. And when you're a man, you're not going to have this issue. You can just go, the 13 is at the third rib, and so you just go a little bit lower than that. So see what feels right for you. And see now if that 15 here is starting, if that pain is starting to release. And then we're going to move the hand from the 13 to the opposite lateral high 4, which is here. It's on the head, on the middle of the head, right here. And that's the last step of these 3 flows. So I would really like it if you tell me how you like these flows, and if you have a project, if you are able to resolve it. I would like you to share that with me, and I would like to hear about your practices. I love it when our community is very active and responding to everything I put out there, because that gives me feedback also on what you like and what you like to hear and how you like to practice. So please share with me, and well, let's have a really good beginning of 2021 all together. And Lola and I will see you on Friday with Free Flow Friday. Have a wonderful day.